Hi everybody, I'm dr.nari Heshmati. I'm a board certified OBGYN in the North Puget Sound area near Everett, Washington. And today I'm going to talk to you about miscarriages. And with all of our videos, we like to highlight some of the scenery and natural resources we have in Washington State. So today I'm at Picnic Point Beach Park. This is in Edmonds, Washington. Beautiful beach here. We have some amazing sunsets, some views of the mountains. People love to come out here and relax. Today, this is a hard topic. Miscarriages is something that's really hard on patients. It's really hard on the docs. It's something that people often don't talk about. But miscarriages are unfortunately very, very common. So, around 20% of all clinically recognized pregnancies result in a miscarriage. And what that means by clinically recognized, and I'd stress that point, is that essentially is where we know someone's pregnant and we identify a miscarriage. And a miscarriage is defined as any loss earlier than 20 weeks in pregnancy. Now, the reason I say clinically recognized is if we were checking urine pregnancy tests on women, we might see a miscarriage rate of 30% or higher, because many people will have a very early miscarriage, and the miscarriage rates are higher the earlier you are, and think that they just had a late period or a heavy period or things like that. One thing I would just throw out there is the medical term for a miscarriage is a spontaneous abortion. And you might see that in a chart note or something. I know my group and many other groups were starting to do open records where you can get access to all of your notes online. And so if you see that, sometimes that can be confusing for someone. That's just our term for a miscarriage. Now, a lot of times patients will come and ask me and they'll go, well, at what point is it safe for us to start telling friends and family that we're pregnant? Because they're excited, they want to share the news, but they also don't want to necessarily have to tell people they've had a miscarriage. So they go, well, at what point is that safe? And so the miscarriage rate goes down the further along you get. So for instance, at 15 weeks, the risk of miscarriage is less than 1%. I personally, my wife and I, when did we tell people, when do I notice colleagues tell people? Typically somewhere after about 10 weeks of pregnancy seems to be a safe time. Now, there are risk factors that make you more prone to a miscarriage than others. So if you've had a miscarriage before, there's a slight higher risk of a miscarriage. But the most common risk factor we're going to see out there that's associated is going to be age. So a 40-year-old, for instance, has a much higher risk of miscarriage than a 20-year-old. And that probably has to do, if you saw our video on screening and testing for chromosomal abnormalities, there's increased spontaneous chromosomal abnormalities, and that's the #1 cause of early miscarriages. So for instance, a 45-year-old could have up to an 80% risk of miscarriage. Now, we can't really do much about age, but there are some other risk factors out there. So if you're a smoker, it's a good idea to stop, because smoking is associated with a higher miscarriage rate. If you drink heavy alcohol, that's also associated with a higher miscarriage rate. We discourage things like NSAIDs or ibuprofen during pregnancy. We prefer people take acetaminophen, and ibuprofen has some association with an increased miscarriage rate. Any kind of illicit drug use like cocaine, for instance, can have an increased association with miscarriage rates. One that's come up recently that's made a lot of confusion is, what about caffeine? Can I have coffee? The data is not really good one way or the other. If you're having 1 glass of coffee a day, it's probably fine. Probably avoid excessive uses of caffeine just in case. Now, if we were actually to look and say, what is the cause of a miscarriage? First, I want to start off, the first response when somebody has a miscarriage, they're thinking, what did I do yesterday? What did I do last week? Could I have done something differently? Was I too active? In general, you can't cause a miscarriage. It's not your fault. There's nothing you did. It was not preventable. So I want to put that to rest right off the bat. Now, if we were to identify what actually causes a miscarriage, more than half of those are chromosomal abnormalities. Again, spontaneous mutations, too little, too much DNA, and a miscarriage results. Other reasons that we'll see miscarriages less commonly, structural defects in the uterus. So for instance, if there's a septum inside the uterus, a little dividing line, that area has poor vascularity or poor blood flow. So if an embryo implants there, there's a higher risk of miscarriage. Now, if you've got a septum, I wouldn't necessarily be concerned. Many women with uterine septums do fine, but if somebody does have a uterine septum and recurrent miscarriages, we're going to talk about going in there and resecting that down. Other possible reasons out there, if somebody's a poorly controlled diabetic, poor thyroid function, those things can increase your miscarriage rate. And there is something called antiphospholipid antibody syndrome. Imagine an autoimmune disorder where you have increased clotting, and that's when we'll sometimes put people on heparin or baby aspirin. But again, the bulk of miscarriages are just spontaneous chromosomal abnormalities. Now, how do you know that you're having a miscarriage? Unfortunately, some women will just show up at that very first visit, will do an ultrasound, and will be suspicious that there's a miscarriage. If you do have signs or symptoms, it's typically going to be bleeding and cramping. Now, just because there's bleeding and cramping does not mean you're having a miscarriage. 20 to 40% of all pregnancies in the first trimester are going to have some form of bleeding. The amount of bleeding doesn't correlate with whether you're having a miscarriage or not. I've seen people have excessive amounts of bleeding where I thought this can't be a viable pregnancy, and everything's turned out fine. But certainly we want you to call us if you're having bleeding and cramping. We can't prevent a miscarriage, but we can get information to either reassure you or determine what's going on. And how we do that is we can do blood work, the beta-HCG, the pregnancy hormone, and we can do early ultrasounds. So the beta-HCG, that blood work, is going to, what we say, double every 48 hours. The actual answer is it goes up somewhere between 50 to 100% every 48 hours until about 9 to 11 weeks. So we can follow those levels and make sure they're rising appropriately. Once you have a beta-HCG of about 1,500 to 2,000, you can actually see a pregnancy inside of the uterus. Now that's too early to actually see a heartbeat, but typically a week, 10 days, 2 weeks after that, somewhere around the 5.5 to 6.5 week mark, we're going to see a heartbeat. So we can often get a follow-up ultrasound for reassurance. Now, it's not uncommon to see a little area of bleeding or a perigestational hemorrhage around the baby, and those are typically fine and resolve on their own. The fact of seeing a heartbeat can be very reassuring. The times we get concerned with an ultrasound is if you have a heartbeat less than 100, there's a higher risk of miscarriage. If we see a heartbeat that's really low, less than 70, it's almost certainly a miscarriage. Now, let's say there has been a miscarriage. The question comes up, well, what can we do at this point? And if you're comfortable with it, and there's a couple options, but it really comes down to what you want and what you're comfortable with. One option is waiting to see if you pass the miscarriage, and we can wait 3 or 4 weeks. For many patients, though, they really want to move on from the episode, so they'll say, is there something we can do to speed up the process? And the options there are both medical and surgical. So medical, we have some pills called misoprostol we can prescribe you at home, kind of on your own time. You can take these, and it's going to make the uterus cramp and contract and help you pass things. Now, there's a lot of bleeding and cramping, and that can be traumatic for patients. So some will opt for a DNC, and that's a dilation and curettage, where we actually go, for instance, to the operating room and we can put somebody to sleep and we can empty out the uterus. That's got some higher costs and some surgical risk, but for some people that's the right option for them. So really sitting down and talking to your OBGYN about what are my choices, where I am, and what's appropriate for me is going to be important. Now, a lot of times patients will say, well, can we test to see what caused the miscarriage? And again, in general, most miscarriages early on are chromosomal abnormalities, so we don't do any testing for it. Now, when we start to get suspicious that something else is going on is if somebody's had multiple miscarriages, 3 in a row, 2 or more. If somebody has a late first trimester, early second trimester miscarriage, so if somebody has a 13 or 14 week miscarriage, you become suspicious that this wasn't your standard spontaneous chromosomal abnormality, and there's testing and things that we can look at that point. Now, we do get into some controversial areas because while there are some things that have solid evidence and data, like giving people baby aspirin or heparin for antiphospholipid antibody syndrome, there are other things that remain very controversial. Should you put people on progesterone for a luteal phase defect, and that's progesterone's created by the body early on and gets converted and the pregnancy takes over that function at 10 to 12 weeks, and if there's a deficiency that could cause a miscarriage, the data's all over the place. I simply sit down with patients, I talk about this is what we've got, this is where the data is, what do we want to try to do? Now, in general, if you've had a miscarriage, it's normal to be nervous in a future pregnancy. My wife and I had a miscarriage. It's really hard the next time. You're anxious, you're wondering, is everything okay? And while we can't do anything to change anything, it's not wrong to get an early ultrasound or things like that just to get some reassurance and make sure things are progressing fine. Again, it's normal to be anxious. A lot of times people will have a miscarriage and they go, will I have another baby? And I want to reassure you that in general, typically you're going to be fine and you will have another pregnancy. Most people do go on to do that. In fact, you may have heard the term rainbow baby or a rainbow child. And what that is anybody who has a baby following a miscarriage or a loss, whether it's a stillbirth or anything like that, they refer to that as a rainbow baby. And what that is the miscarriage is the storm. It's the dark time. And then after the storm goes, and the storm always passes, then we see a rainbow, something bright, full of hope. And that's a sign of the future, and that's the rainbow baby. In fact, I borrowed from my wife her wrap. For those of you who know my wife, she really is into the whole baby wrapping and great thing. She loves to carry the baby, and this is actually her wrap from our daughter, Serena Aria. This is our baby girl that we had following a miscarriage, and it's a rainbow wrap. So again, it signifies this was our hope, after the difficult time of the miscarriage and the storm. So I hope that provided you some information about miscarriages. Again, there's nothing you could have done to prevent one, and we're here to help and support in any way we can, and I hope that answers your questions.